Hello everybody, I'm RJ Trishul from Radio City 91.1. So today we are going to know about Hodgkin lymphoma because this is the awareness webinar, and today we have Dr. Mallikarjun Kalashetty with us. So doctor, would you please introduce yourself?
Hi Trishul, thank you for having me. My name is Dr. Mallikarjun Kalashetty. I'm a head of the Department of Clinical Hematology, Hemato-Oncology, Bone Marrow Transplantation and Cellular Therapy at Manipal Hospital, Old Airport Road, Bangalore. I deal with blood cancers, bone marrow transplantation and various other blood disorders. Thank you.
Welcome to the show, sir.
Thank you so much for having me.
So today we are going to know about this Hodgkin lymphoma and myth, support, everything about Hodgkin lymphoma.
Sure.
So this is going to be a support and positive interview today.
Sure.
So first of all, I would like to ask, let's begin with the basics.
Yeah.
So what is this Hodgkin lymphoma and how is it different from other cancers?
Yeah. So Hodgkin's lymphoma is a type of blood cancer, right? First of all, the moment you utter word cancer, people become anxious. They have a sea of emotions, charging them, and it is very difficult to talk to them beyond those emotions. But so largely we divide cancers into blood cancers and solid organ cancers. I'm a hemato-oncologist. I deal with blood cancers. So the moment you say cancer, people have some basic questions. What is the stage? What is the type? Are you going to cure? So when you talk about cancer, solid organ cancers are cancers of lung, liver, breast, prostate, which are treated differently, which are staged differently. Whereas blood cancer, the common types are acute leukemia, lymphoma, myeloma, chronic leukemias. So Hodgkin's lymphoma is a type of lymphoma. We divide lymphomas into two subtypes, the Hodgkin's and non-Hodgkin's. The Hodgkin's one derives its name from a British pathologist named Thomas Hodgkin, who initially described. So he was the one who first described these patients who had lymph node enlargement. And one of the pathognomonic cell of Hodgkin's lymphoma is Reed-Sternberg cell, which derives its name by a couple of doctors, Dorothy Reed and Sternberg, right? So Hodgkin's lymphoma is a type of blood cancer classified in the lymphoma category. The common variant of lymphoma is non-Hodgkin's lymphoma. However, Hodgkin's lymphoma is something that can occur in about 10% of patients of blood cancer, has its own distinct pathobiology, distinct classification, distinct symptomatology and treatment.
Okay. So how common is this Hodgkin lymphoma, especially in India?
Yeah.
And who are at the risk?
Yeah. So, if you were to take just cancers, the blood cancers themselves account for about 8 to 10% of all cancers. And of the blood cancers, Hodgkin's lymphoma is one of the not so common lymphoma, because non-Hodgkin's lymphoma accounts for about 80 to 85% and Hodgkin's lymphoma about 10 to 15% of the cancers. So it is not very common. However, it is very important to diagnose and distinguish this lymphoma from other types of lymphoma, because treatment is very evolved. It is one of the most curable cancer. In fact, amongst cancers, Hodgkin's lymphoma is one of the cancer which has the most probability of being cured.
And what are the symptoms of this Hodgkin lymphoma?
Yeah, it's a very important question, and we have to make sure that our viewers understand this well. So the commonest presentation of lymphoma is lymph node enlargement. We call those nodal lymphomas. So most patients of Hodgkin's lymphoma will have enlargement of the lymph nodes, and most commonly in the cervical area, but it can also be in axillary area, inguinal area, abdominal lymph nodes. So lymph node enlargement, which oftentimes is painless, progressive, and does not get better after multiple course of antibiotics, should raise suspicion. They can also have host of systemic symptoms that we call loss of weight, loss of appetite, drenching night sweats, sometimes pruritus, itching for no rhyme or reason. So anyone who has these symptoms which are persisting must go to the physicians or the oncologist so that they are investigated. And the diagnosis of Hodgkin's lymphoma itself is very simple, and one can get to the real diagnosis in a very rapid point of time.
I think one of the most common symptoms amongst all the cancers are unintentional weight loss.
True. That is true. So, cancer cachexia it was called as. So, unintentional weight loss, fevers which are periodic, call it, fevers on and off without any focus of infection, and patients having aches and pains and bone pains, all of these should raise a suspicion.
And once someone sees a doctor with these symptoms, how Hodgkin lymphoma is diagnosed?
Yeah, so again, people have a lot of anxiety. Sometimes patients are very wary of going to doctors and getting these investigations done. When you go to a doctor with these symptoms, the first thing the doctor is going to do is do a detailed physical examination. Head to toe examination, look at lymph nodes, how big, how many of them are there, what is their distribution, are they painful, are there other telltale signs of cancer. So a good physical examination is first thing, and then they're going to order a host of investigations, including initial blood investigations, biochemical investigations. However, the diagnosis itself is arrived at by two important things. Number one, the imaging of the body to find out what is the distribution, disease burden, and which all the lymph node sites are involved. Second one is by actually removing a part of lymph node or a whole lymph node, called as lymph node excision biopsy, which is then looked at under the microscope by pathologist, who will look at the morphology initially, and then they're going to do more advanced specific test called as immunohistochemistry to subtype cancer. So the diagnosis by histopathological examination of the lymph node biopsy.
And what does the treatment journey looks like?
Yeah, so again, a lot of anxieties. So the treatment of cancer itself has evolved over last several decades. I'm sure you're aware. All of us have moved from more generic, non-individualized chemotherapy-based treatment, which though were effective in certain number of patients, would also have awful side effects. So we all have moved to more targeted therapies. However, Hodgkin's lymphoma is one of the cancers which even had very good cure rate even with conventional chemotherapy. One of the chemotherapy protocols that we have used for Hodgkin's lymphoma is a protocol called as ABVD, which is combination of chemotherapy agents. When we have a newly diagnosed patient of Hodgkin's lymphoma, first we want to stage them, whether they have localized disease or early disease, whether they have advanced stage disease, which is very important because patients who have localized disease without lot of disease burden can easily be treated with abbreviated course of therapy, which oftentimes can be conventional chemotherapy, yet they can achieve a very high cure rate. However, if the patients have advanced stage disease, have high disease burden, have more systemic symptoms, we also have the conventional chemotherapy, but apart from that we have more nuanced, more targeted therapy which can be used. So we call those immunotherapeutic modalities. So we can combine the newer agents with old school chemotherapy and improve the cure rate and yet reduce the toxicity. And so we have evolved in treating Hodgkin's lymphoma patients.
And there is a saying that the journey of chemotherapy will be more painful. Is that true?
Yeah, no, so there is some truth to it. However, not true in entirety. We must try and make sure that patients and families understand that conventional high dose toxic chemotherapy is something that we are using lesser and lesser in the cancer care. We have moved to more targeted, more individualized, more disease centric therapy, and these are not as awful as toxic as the conventional therapy were, and yet they are likely to be much more effective than the conventional therapies. And even in those few patients where we have to use conventional chemotherapy, there are protocols which can reduce chemotherapy induced nausea, vomiting. We can give medications to make sure that they are having a good reasonable quality of life. We also have to make sure that we look at their heart, their kidney, their lungs to make sure that they are not suffering the toxicity of the medicine. So all of these are done in a systematic protocolized manner. Patients can go through the treatment much better today than they would be several years before.
And how much difference does the early detection really make?
Extremely important. It's something that I would request you and your colleagues to make sure that we as caregivers, as families, as communities, number one, make sure that we do not consider cancer as a taboo. There is no need to hide. It's an illness that nobody has control over. Number two, early detection is extremely important. In fact, all medicine practice says prevention is better than cure. However, early detection is extremely important in cancer care. Somebody who has a less disease burden, has localized disease, the treatment is easier, cure rate is very high, as against somebody who has a high disease burden, has more advanced form of disease, so their outcome is not perhaps as good. Not that it is very bad today, but yes, it is extremely important to diagnose all lymphomas, all cancers in the early stage.
Okay, so now we have one interesting segment to clean up the myths around this Hodgkin's lymphoma.
Sure.
So I have few myths. Okay, so myth number one: only older people get Hodgkin lymphoma. Not
true, actually. So we used to say Hodgkin's lymphoma has a bimodal presentation. So young people, adolescents and young adults can develop Hodgkin's lymphoma too. In fact, lymphoma as a group can affect any age. So it is not true that only elderly people develop Hodgkin's lymphoma. No.
Okay. And there is another myth: swollen lymph nodes are always mean cancer.
No, not true again. I'm glad you have come up with these myths. We must, bust these myths. So, not every enlarged lymph node is a cancer. For example, tuberculosis is one of the commonest cause for enlarged lymph nodes in India. So, one must not presume that if there is an enlarged lymph node, it is a cancer. At the end of the day, the diagnosis is by doing the lymph node biopsy and looking under the microscope.
Okay. So cancer treatment always leads to unbearable side effects.
Not true again. In fact, most patients during the treatment continue to do their work, at least work from home. So not all cancer treatment is painful. Not all cancer treatment leads to irreversible toxicity. No, that's not true.
Okay. So if Hodgkin lymphoma comes back, there are no options left.
No, again, again, not true. There was a time when we would worry about all relapsed lymphomas. However, if a lymphoma or, for example, Hodgkin's lymphoma relapses, we look at certain things. What was the stage at initial diagnosis? What was the duration of first remission? What was the chemotherapy protocol or immunotherapy protocol that the patient received? So, number one, we can treat even the relapsed Hodgkin's lymphoma very well. The treatment and the success depends on what was the initial protocol used and what was the duration of remission. We have much better, much effective and much targeting agents in terms of immunotherapy for Hodgkin's lymphoma. It could be brentuximab, it could be nivolumab, it could be pembrolizumab. There are various newer agents that one can use. And we also have something called as autologous bone marrow transplantation. So we use these salvage protocols to put the patient back in remission, meaning to reduce those burden of the disease again, and then do something called as autologous bone marrow transplantation, which can cure almost half or 50 to 60% of those patients with relapsed lymphoma. Yeah.
Okay. I think you have cleared all the myths around this Hodgkin's lymphoma now.
I hope it helps. Yeah.
Let's move to the next segment.
Sure.
This is living with and beyond Hodgkin lymphoma.
Yeah.
So the first question is, how can patients and their families cope emotionally with the Hodgkin lymphoma diagnosis?
Yeah. So like any other cancer diagnosis, when you break the news of a cancer, people go through those emotions of anger, of denial, and then, making peace with it. So we must make sure that we are supportive as individuals, as caregivers, and as family. Remember, no matter how much we empathize, it is the person who's having the diagnosis who's suffering the most and who's feeling the lowest. So we must be very mindful of that fact. And also, what should give us more courage and conviction is most of these patients are going to do well at the end of the day. So the success rates of Hodgkin's lymphoma treatment are over the roof now. Most patients are likely to do well.
So can individuals return to normal life after treatment?
Oh, absolutely. So once you complete your treatment and the disease is gone, you are a normal person for all accounts. Of course. That is the whole idea of treating people. Yeah.
Super. So we are coming to the end of this interview. So we have Dr. Mallikarjun Kalashetty with us, and what is the one message you would like to give to the public?
Yeah, so I would say, number one, be careful about suspicious symptoms. Number two, don't be in denial. Number three, remember, cancer care, more so Hodgkin's lymphoma care has evolved, and more patients are likely to do well and will be completely cured of the treatment. Treatment itself is neither painful nor will it have lasting toxicities. Thank you for having me.
And I would like to add one more thing. Don't just Google your symptoms.
Yes, there is no filter on Google, right? Yeah.
So whatever pain you search for, it will show cancer.
Yes,
ultimately.
Certainly. Yeah.
So thank you so much,
Thank
Doctor.
you.
So today we came to know a lot about this Hodgkin's lymphoma and myths around this Hodgkin's lymphoma, and you have cleared everything.
I hope so. I tried.
Thank you so much.
Thank you. Thank you for having me.